I'm going to talk about the coronavirus. I'm pleased to speak for the Greater Works Women Fellowship. We're going to cover the basics and beyond and talk about science and facts. This is an outline of what we'll talk about. First, we'll touch on what is the coronavirus, who is at risk, how is it spread, how to prevent infection, what to do if someone I know is sick with the coronavirus, children and the coronavirus and the community, cleaning and disinfecting, and testing and symptoms. So the coronavirus is also known as COVID-19 or the novel coronavirus 19. Novel means new. It's never been seen in humans before. There are other coronaviruses that cause the common cold in the same family, but our immune system have not seen this virus before. The CO in COVID stands for corona, the VI stands for virus, and the D stands for disease. The 19 behind it is because it was discovered in 2019. Who is at risk? As you get older, your risk for severe illness from COVID-19 increases. For example, people in their 50s are at higher risk for severe illness than people in their 40s. Similarly, people in their 60s or 70s are in general at higher risk for severe illness than people in their 50s. The greater risk for severe illness from COVID-19 is among those aged 85 and older. This is a slide from the CDC website looking at hospitalizations and death rates. If you start to look here, between 50 and 64, your risk compared to the 18 to 29-year-olds is 4 times higher. Go up 10 more years, it's 5 times higher. 75 to 84 is 8 times higher. And as we mature and are 85 and older, you're 13 times higher to get hospitalized. The death rate is 10 times, 30 times, 90 times higher if you're 65 and older. 220 times higher than a 29-year-old when you're 75 years of age and older. Some of the CDC recommendations are posted on almost every type of available literature. Report wearing a mask, maintaining 6 feet goal, hand hygiene, cleaning and disinfecting. There are also other factors that can increase your risk for severe illness, such as having underlying medical conditions. Those conditions include cancer, chronic kidney problems, chronic lung problems, if you're immunocompromised, such as those patients that have received a liver, kidney, heart transplant. If you're obese, if your BMI is higher than 30, you are definitely at increased risk. If you have serious heart conditions or coronary artery disease, sickle cell disease, and type 2 diabetes. These are the COVID-19 associated hospitalizations related to underlying medical conditions. And you can see that if you have asthma, hypertension, if you're obese, meaning your BMI is more than 30, you have a 3 times risk of being hospitalized. If your BMI is above 40, you have 4.5 times the risk of being hospitalized. And again, another CDC hallmark is wearing a mask, maintaining 6 feet away from other people, hand hygiene, cleaning and disinfecting. Who might be at risk? Patients with asthma, cerebrovascular disease. These are diseases that affect the blood vessels and blood supply to the brain. Cystic fibrosis, high blood pressure, patients with HIV or weakened immune systems, neurological conditions such as dementia, liver diseases, pregnancy, again, lung problems, smoking, a couple of rare blood disorders, and type 1 diabetes. So how is it spread? It's spread from person to person. It's spread from respiratory droplets, from talking, sneezing, or coughing, which land on or in the nose and mouth. This is the basis of the 6-foot rule. Respiratory droplets from speaking, sneezing, and coughs usually do not spread more than 6 feet. Can it spread through food, takeout, packaged, refrigerated, or frozen? No, it doesn't. It's spread from person to person. So wash your hands for at least 20 seconds with soap and water before you prepare food, or use hand sanitizer with 60% alcohol and use it to cover all the surfaces of your hands. Wash your hands with soap and water after sneezing, coughing into a tissue, or using the restroom, or use the hand sanitizer as mentioned above. What about warmer weather? There's no evidence that warmer weather will decrease the risk of transmission. In fact, due to warmer weather, more people will gather inside where it's cooler, and infection can spread from person to person through respiratory droplets. Some indoor facilities will recycle air rather than bring air in from the outside because it's more cost effective. One question I've heard before is, can mosquitoes spread the coronavirus? Again, there's no evidence that mosquitoes or ticks can spread the virus. It's spread from person to person. How to prevent becoming infected with COVID-19. Wear a mask in public. Wash your hands often and after you, number 1, touch your mask. Number 2, have been in a public place. Number 3, touching animals or pets. Number 4, changing a diaper. I hope you would wash your hands anyways. Number 5, before eating food, before preparing food. And number 6, after caring for someone that is sick with any illness. Wearing a mask. This is the most important thing that we can do to mitigate the spread of this disease. But it has to be worn properly. Sometimes I see people with the mask underneath the nose and the nose hanging out. Well, that doesn't do much. It has to cover your nose and mouth. If the mask is low, tell them you gotta go. Number 1, the best face covering or mask needs to completely cover the mouth and nose. If the mask is not covering the nose, you need to tell them you gotta go. Some kind ways that I've learned is says, excuse me, you're not wearing your mask correctly. It needs to cover your nose and your mouth. And you can always say this to people. Our healthcare workers wear a mask for 10 hours a day, removing it only to eat and drink. Do not touch your face, nose, or mouth, especially if you have not washed your hands or used hand sanitizer. Do not come in contact within 6 feet with people in public without wearing a mask. More on prevention. In addition to washing your hands and wearing a mask in public that covers your nose and mouth, you need to do everything you can to stay healthy. Your immune system is the most important way to fight this infection. So take care of it. Eat healthy. Exercise 30 minutes with a brisk walk or run. And if you're alone outside, you don't need to wear a mask. Remember that exercise helps your immune system fight off infections. Glasses versus contacts. There's no evidence that wearing contacts places anyone at higher risk of contracting the coronavirus. The coronavirus can infect the lining of the eyes, called the conjunctiva, and eyewear can be worn for healthcare providers in close contact with someone infected with the coronavirus. It is not a CDC guideline or recommendation for the general public. What cleaning products should I use to protect myself? Clean and disinfect frequently touched surfaces such as tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. To disinfect, you can use the most common EPA-registered household disinfectants. Wearing gloves. These are only necessary if you're caring for a confirmed infected patient with coronavirus. The best way to protect yourself is to wear a mask and wash your hands or use hand sanitizer after running errands or being in public. You may place yourself at higher risk if you wear gloves because you may touch your face, touch your mask, and then after touching a surface of something that's infected with the coronavirus. So it's just better not to wear gloves because it just complicates things. What about if you or someone you know is sick? First thing you want to do is stay home, except for obtaining medical care. Use a separate room and bathroom for sick household members if possible. Wash your hands often with soap and water for at least 20 seconds, especially after blowing the nose, coughing, sneezing, going to the bathroom, and before eating or preparing foods. And as I mentioned before, if soap and water are not available, you can use hand sanitizer with 60% alcohol. If you or someone you know is sick, you can provide sick household members with clean, disposable face masks to wear at home if available to help prevent spreading COVID-19 to others. Clean the sick room and bathroom as needed to avoid unnecessary contact with the sick person. Seeking medical attention if you or someone else are ill, such as having problems breathing, having pain or pressure in the chest, being confused, inability to stay awake, bluish lips or face, and call 911 and inform them that you're caring for a patient with confirmed COVID-19. What if I come in contact with someone that tests positive for COVID-19 but doesn't have any symptoms? If you develop symptoms such as fever, cough, shortness of breath, seek medical attention. Take your temperature at home. Children and the coronavirus. There's been a lot of back and forth in the news about this recently. They have a lower chance of falling ill due to their robust immune systems. They can transmit the disease to adults. They need to wear a mask in public, only if they're 2 years and older. Do not place a mask on a child younger than 2. You will suffocate them. Kids can play with their friends if they're wearing a mask and maintain a 6-foot social distancing. And all you have to do is tell them to wash their hands or sanitize their hands frequently. Coronavirus in the community, what can you do? Wash your hands, avoid contact with close contacts with people that are sick, and practice social distancing. The covering of your mouth and nose with a mask while around others, covering coughs and sneezes, cleaning and disinfecting frequently touched surfaces daily. How about in the community? Well, we can ask people to change their behaviors to prevent the spread, can maintain healthy environments, maintain healthy operations, prepare for when someone is going to get sick, closing businesses and schools and limiting other services. Of course, there are newer guidelines that tell us how long businesses should be closed and proper disinfecting of surfaces. So what's the difference between cleaning and disinfecting? Cleaning with soap and water removes germs, dirt, and impurities from surfaces. It lowers the risk of spreading infection. Disinfecting kills germs on the surfaces. By killing germs on a surface after cleaning, it can further lower the risk of spreading infection. Cleaning in the community. Most surfaces in the community should be disinfected regularly. Most businesses have been given specific instructions by the Center for Disease Controls. control. You should maintain existing cleaning and hygiene practices for outdoor areas. If practical, high-touch surfaces made of plastic or metal, such as grab bars and railing, should be cleaned routinely. Cleaning or disinfecting wooden surfaces such as benches, chairs, and tables do not need to be cleaned, as long as they're not high-touch areas. What are high-touch areas? These are surfaces that are touched on a frequent basis, every few minutes, by people. More on children and playgrounds. Playgrounds don't need to be disinfected, but they do need to be cleaned. Remember, cleaning is with soap and water to remove germs, dirt, and impurities from surfaces. Disinfecting is killing germs on a surface. Spraying disinfectant on outdoor playgrounds is not an efficient use of disinfectant supplies and has not been proven to reduce the risk of COVID-19 to the public. What if I'm caring for someone that's sick with the coronavirus? Wear a mask, glove, and eye protection. Clean all high-touch surfaces every day. Call ahead before visiting your doctor if you become ill. Testing and symptoms. Testing continues to change on a daily basis. The newest test that's FDA approved is a saliva test. Most of you know this already, but the symptoms that you'll experience would be fever, cough, shortness of breath. Remember, this disease presents differently in different patients. Some people will have no symptoms at all. In summary, wear a mask in public and maintain a 6-foot distance from others. Wear a mask the right way, covering the nose and mouth. Wash your hands frequently, especially after being in public, and monitor yourself for symptoms. Keep your body healthy with a balanced diet and exercise. And stay home if you're sick. Seek medical attention for any symptoms such as fever, shortness of breath, and cough. Thank you very much for allowing me to present these facts on the coronavirus. Stay safe.